So, research being done on how to prevent kidney disease in patients with cardiovascular conditions. Oh yeah, there's a lot of cardiovascular research. I'm pretty sure there's like I mean, I could, yeah, if I'm pretty sure if you put into PubMed kidney and hypertension, you're going to pull up a lot of recent research. All right, so let's talk about arteriosclerosis. This is one complication that can happen with hypertension. So what we have here is a cross section of a blood vessel, and this white stuff here is actually the wall. Now this yellow stuff, that is a plaque. So it's kind of like having a pipe that's coated with all this grease. What we have here is a very thick layer of fat. And what happened to this is the original diameter here, but what happens with the new diameter? What about the actual free space in the lumen? You went from this diameter to this small diameter. And this is looking at, this is a really extreme case. This is the original, and I think the tunica media here, this is probably the tunica intima right here. But now we have this huge plaque pushing all the way from this original vessel diameter to a very small vessel diameter. So atherosclerosis, and okay, so I looked up, so the thing is that what's the difference between arteriosclerosis and atherosclerosis? So I know I even had to look up, and if you actually look on multiple medical resources, sometimes they say they're synonyms. What I saw is that in general, arteriosclerosis talks about hardening of the walls of the arteries, whereas atherosclerosis is more specific and refers to the hardening of the arteries, but is narrowing as well due to the acquisition and deposition of these fatty plaques. Yeah, so what causes, so the thing is that what can cause it? Well, if you have a lot diet high in fats, when lipids and cholesterol, or if something is affecting your lipid metabolism and how you clear it from your circulation, that can cause these accumulation of these plaques. Hyperglycemia as well. So the interesting thing is, well, hyperglycemia can also damage these blood vessels and also cause them to be more prone to accumulating these plaques. Smoking definitely causes arteriosclerosis, and it's also linked to increased risk of atherosclerosis. And high blood pressure, hypertension. So basically, if you damage your vessels in any way, anything that can potentially damage your blood vessels can damage your cause like these kind of predispose these so things that your inside of your blood vessels should be smooth, but if you start damaging them, well, it starts to make these little sites where these plaques can start to form. So there's something more for them to grab onto. That's what's kind of like, so if there's something for these plaques to start and build up, initiate and build up in the first place, well, if it builds up over time, you can have this atherosclerosis and this narrowing. Ooh, lots of questions. Family history of heart disease and hypertension. Okay. Yeah, that's the thing. It's like if your doc isn't treating that, I mean, you can always get. I know Medicare is. I mean, healthcare is expensive, but it might be one of those times where you just have to get a second opinion, because yeah, you should have a good relationship with your doctor or health professionals that take care of you. And normal plaque levels. So normal, that's an interesting term. So the thing is that everybody develops some extent of atherosclerosis, and it's like, how do we determine normal? Well, are we going to say like how many plaques someone has in their whole body, or average plaque per length? I mean, this is interesting because like we could have someone who has never had cardiovascular disease, ate healthy, and had a low-fat diet, and they'll still have some level of atherosclerosis. So yeah, it's a natural process, but you don't want it to get to this point where it starts to cut off blood flow completely, or when you're almost complete, drastic reduction in blood flow. Yep. So overall, at the time of plaque building, it would block the artery, yep, or narrow the flow. Yeah. So this is when we have to go back to this equation. Oh no, yeah, right. So again, here we're going to start off with a base value. And what happens if we start to like cut? So what if that vessel, the radius, is now half the radius? So we're going to have 50% of that radius with this new radius. Well, what do? Well, we're going to plug this into the original equation. And if you put this in the original equation, well, so our new flow is going to be this. Oh, I switched from the F to Q, so again, Q is blood flow. But what happens is that if you substitute this, remember that this variable has R2. You have to put the whole equation here into this exponent. So what do? Well, you distribute this exponent. I know it's back to algebra, back to high school, but you take 0.5 to the fourth power and the radius to the fourth power. And what happens if you put 0.5 to the fourth power? Well, now you have this 0.0625 of there, and this is the original radius. Now let's just separate that 0.0625 from the rest of the equation. Well, what do we have here? This part over here is equal to our original flow. So by having the radius of a blood vessel, you cut your overall flow to just a little over 6% of your original flow. Yeah, so am I going to expect you to do this? This might be, yeah, I won't expect something at this level, but FYI, this is why a narrowing of your arteries to that extreme extent will drastically reduce your blood flow. Because again, we went from just by having the radius, you cut your blood flow to almost 6% of its original. And what does that mean for your blood pressure? So what does that do? Well, the thing is that by increasing your resistance, and why is it increasing the resistance? You might be like, wait, wasn't the radius on the top of that original equation? Well, if you do that algebra magic and then you put you put pressure by itself, this part right here is your radius. And this radius right here, resistance, or actually not radius. So it's, remember, pressure over resistance. So resistance equals this big equation right here. But in general, remember, if a denominator of a fraction gets bigger, the overall number gets smaller, right? So the opposite is true. If the denominator gets smaller, then the overall number gets bigger. Same applies here. So by resistance increasing, we decrease the blood flow. So again, more resistance, less blood flow. So this is why atherosclerosis is very problematic, especially if it narrows to the point that if an errant clot or something else comes in and blocks one of these arteries, well, what's that going to do? It's going to prevent blood flow to that area, cause ischemia, or what if you have narrowing of the arteries in your coronary arteries, and then you get a clot forming and then blocking one of those coronary arteries? Well, it's going to cause a heart attack, right? A myocardial infarction. So this is why atherosclerosis is difficult. I mean, there's more ways of monitoring it now, but again, this is why it's important to kind of prevent this in the first place, or limit the extent. So again, myocardial infarction. What if it happens that you have this atherosclerosis in the heart? And then heart failure as well. Thing is that by narrowing those, that causing more resistance, remember, resistance is anything that generally slows down blood flow. So it's just like having a bunch of people like trying to open a door, but a bunch of people are pushing it up against it. Well, if you're having a hard time pushing up against it and moving, that's going to impede your flow, right? So heart failure, if you're unable to pump blood at a fast enough rate and distribute blood to all your tissues to keep up with demand, that's heart failure. Kidney failure as well. If you, again, it's going to impair blood flow to kidneys. Neurological problems. What if you start having atherosclerosis in the vessels that supply your brain? Confusion, dizziness, and blindness. Aneurysms as well. Again, the thing about these plaques as well, they're hard. They don't flex as well, and they're damage to these vessels. So if you have all of this and increased blood pressure, well, you can develop an aneurysm. Or ischemia if you block off one of these vessels leading to the brain. And we did cover stroke, so cerebral infarction is a stroke.